October is Breast Cancer Awareness Month, and if you're 40 or older, it's a good reminder to schedule your next mammogram. And out here at Women's Health of Central Virginia, you can have your annual exam and your mammogram at the same time. Plus, if you do it this month, you get a free bag as well. Take a look at this.
Breast cancer is the second most common cancer diagnosed in the United States for women, and also the second leading cause of cancer-related deaths for women. So it's very important.
And how often after that age of 40 do women need to come in and get another mammogram?
Yeah, so typically we recommend starting screening at age 40, every 1 to 2 years.
Good to know. And let's talk about the process, because now you offer this at Women's Health of Central Virginia for the last couple of years now. And what is the process like when the woman comes through this door?
Yeah, so most often we can schedule a screening mammogram with your annual exam. And you can either do it before or after your exam. It's an easy process. You come in, and it usually just takes a couple minutes.
And I know it's kind of worrisome because a woman's concerned it's going to squish hard, but it really doesn't take that long. I was actually very surprised.
Yeah, it's just a couple seconds, usually very well tolerated.
And I know personally with me, I had a cyst on my first mammogram. It was a 2D mammogram. I had to go and get more imaging done. Naturally, I was stressed out. But the great thing about this machine is it's actually 3D. Tell me how that works.
Yeah, so it takes multiple images in a 3D segment to create a 3D model of the breast, and that can allow for better viewing.
So then if a woman has like a cyst, you'll be able to know that kind of thing, and it's
Absolutely.
not cancerous, right?
Yeah, and so if there's any concern on a screening mammogram, we do recommend a diagnostic mammogram, possibly an ultrasound, and those are generally done at Virginia Baptist.
And what if cancer is found? What happens then?
Yeah, so if cancer is diagnosed, typically that's on a biopsy after an ultrasound or diagnostic mammogram, and the next step is to see a breast surgeon.
And there are aggressive forms of cancer, right, that can pop up between mammograms. That is one of the reasons you really push women to get mammograms on a regular basis, right?
Correct. So screening mammograms can catch cancer at a much earlier stage. So if women are diagnosed at stage 1, the 5-year survival rate is over 95%.
Good to know. And let's talk a little bit about the history of this practice. You all have been in this area for a very long time, right?
Yeah, over 25 years.
And you are newer to the practice. Tell me about
Yes.
yourself.
Yeah, so I did my medical training here at Liberty University for medical school, and then went up to Akron, Ohio for residency. Came back because we loved the area, and it was a great place to raise a family.
And if some woman out there is interested in coming in here, what is the process for her to get signed up and seeing somebody?
Yeah, so it's very easy. You can either call today to get an annual exam, or as well as a mammogram if needed.
And speaking of which, to find out more or book an appointment, give them a call, 434-239-7890. Check them out on social media or head online to womenshealthofcentralvirginia.com.